So we presented basically the first time results of DREAMM-8, which is a phase 3 randomized study that looks at Belantamab mafodotin, which is an antibody-drug conjugate that binds to BCMA in combination with Pomalidomide and Dexamethasone, compared to Pomalidomide, Bortezomib, and Dexamethasone. This was a study that was conducted in patients who've received one prior line of therapy and are lenalidomide exposed. And what we see in the study is that it met its primary endpoint, and we see a longer progression-free survival in the patients who got Bela-PD than those who got PVD. And there was a significant decrease in the risk of progression and death by about twofold in the Bela-PD compared to the PVD arm. That was highly statistically significant, as well as clinically meaningful in those patients. In addition, we found that all the other efficacy endpoints, including depth of response, duration of response, progression-free survival 2, were all positive in favor of Belantamab PD. All the pre-specified subgroups also showed a progression-free survival benefit. And finally, although the overall survival data is immature, we do see a trend to overall survival benefit with a hazard ratio of 0.77, and that's despite patients in the PVD arm getting highly effective anti-myeloma therapy. And finally, we looked at the safety in this phase 3 study, and what we saw was essentially that the safety profile for Bela-PD is consistent with that of the individual agents. So we see primarily neutropenia, thrombocytopenia, infection, but by far the most common adverse event we saw was ocular toxicities, which are known toxicities of MMAF-containing ADCs. Overall, they were very frequent. About 89% of patients experienced visual symptoms, but they were almost all reversible. The majority of patients improved back to baseline, and that's with specific modifications that were required in the protocol, dose holds and dose reductions. And there was no negative impact on the quality of life for patients who were on the Bela-PD arm. So overall, we see sort of a very robust efficacy data, manageable safety profile, and a drug that can be given in the community and is off the shelf, so very accessible for patients.